This is our webinar on what can advocacy do for you. And to start, I'd like to acknowledge the traditional custodians on whose lands we work and live, and we wish to pay our respects to all traditional owners and elders past and present. So in our webinar tonight, we're going to be covering the advocacy team introductions, discussion on the advocacy work, which will take up a reasonable proportion of the evening. We're going to talk a little bit about the APNA Advisory Nurse Panel, and there will be questions and feedback possible at the end. But can I encourage everybody to, if you have questions, just to pop them in the chat, and if we have time during the session, we can answer them, or otherwise we might go back at the end and just see how we go. And we'll do that in that wrap-up period. So, okay, I'd like to welcome Sam Moses. Sam is one of our panelists. Sam is actually our APNA founder and our nurse ambassador. And you'll see around Sam is Ken Griffin, the APNA CEO, Karen Booth, President of the APNA Board of Directors, Frances Cieslak, the APNA Advocacy Manager, and Mia Dillon, our APNA General Manager for Healthcare Solutions. Sam, I might just hand it over to you to talk about our values.
Thanks, Danny. Hi, everyone. Welcome to our Advocacy What We Can Do For You webinar tonight. And thank you for your time and giving that up for us to have a listen to what we have to say, and also to invest in yourselves. Over the last decade, APNA has grown a lot and changed a lot. And we have a lot of strategy and, vision of how we're going to move forward as an organisation, so that we are most able to represent you guys, our members, as best we can. And one of the things that we've done to help support that work is to actually have a look at the values that we've had at APNA, and we felt that it was time to shake it up a bit and make sure that they were reflecting our members and also APNA as an organisation. So these are the three new APNA values that we've come up with. We launched them at the Festival of Nursing in July in Perth earlier this year. They are positive disruptor, better together, and pursue excellence. And these values sit across everything we do at APNA, all of the policies that we have in-house, how we work with each other, and certainly how we work with you as our members, and how we work with our stakeholders as well. There's a little bit of explain that I can do around what each one means. So the positive disruptor one is actually quite a favourite. People seem to like that a lot, and it means that we're community minded and champions of change, which I believe we really do that well, and that we're innately curious, and we're always open to innovation and ideas for the future. Better together, that's kind of the obvious one. We are better together. We're better together with you nationally. The patients, the people that we care for, are better because we're better together, and we work that way. We work in teams, we work in healthcare teams, and to make everything better for everybody, our members, the people that we care for, the communities that we work in, and certainly we're better together with all of the teams that we have in APNA as well. And pursue excellence. We're evidence-based in our approach to everything that we do, and we hold our stakeholders and our members and each other accountable as we strive for the highest standards of excellence. We don't believe that excellence is something that you sit back and just think, yes, we've got there. It's something that we are continually chasing. So that's just a very quick overview of our APNA values, and you'll be able to see something about that soon on our website. Thank you.
Great, thank you very much, Sam. And this really underpins everything we do, of course. So Fran Cieslak, our advocacy manager, is going to talk now about advocacy and our priorities.
Thanks, Danny. So hi, everyone, and thank you, as Sam said, for giving up your time tonight to join us today. We really wanted to come together and I guess be available to you, our members, to explain what we do at APNA within advocacy. And I think the introduction from Sam around values really states and says it all, because advocacy a lot of the time is about building and being better together, but also positively disrupting. And that is making sure that we're not necessarily, we are pushing boundaries, but we're basically challenging and saying, why are things done the way they are done if they are not going to produce the best outcome for Australian communities, essentially? So as Danny said, I'm the new advocacy manager and I'm really excited to be part of this team that's growing and I hope continues to grow so that we can do more work with APNA. So what we do in advocacy essentially is provide you a voice and representation. So that means that, you know, we present as a united voice by being the peak body for primary healthcare nurses in Australia. And we are constantly listening to you through things like our very important annual workforce survey, but also in all the activities that you're involved with APNA. So listening to your feedback when you do some education online, listening to you, you know, what you have to say when you're involved with our programs, and listening to you at any point in time that you want to give us a call or email us, because one of the things about APNA that I think is really exciting is our accessibility. You know, it's not, I think I've heard this a few times now, you know, it's not very often that you get to talk to a CEO and we have a very accessible CEO or a president of an organisation. So we're very, very fortunate at APNA. So we are representing you as a united voice, and that is to raise the profile of primary healthcare nurses and primary healthcare. And I just put up some images there. Some of you might remember Go Getter, Joe Getter, which was an image really to, I guess, remind us during International Year of the Nurse and Midwife just how powerful and how go-getting primary healthcare nurses are. And of course, you can see that Joe Getter of course, had the mask during COVID. So raising the profile, letting ministers and politicians know that primary healthcare is the future of healthcare and that we won't keep people out of hospitals unless we actually invest further into primary healthcare nurses. And you'll be, of course, familiar with scope of practice reviews and lots of things going on, which Karen and Ken will talk to more. But of course, unleashing the primary healthcare nurses' full potential is what we're really trying to push with advocacy. You know, submitting to the scope of practice reviews, being at all the consultations, Ken meeting with ministers and Karen meeting with ministers of health and making sure that they're fully aware of the capability of primary healthcare nurses to do things like leading and coordinating care, but the everyday work that we do that's preventive and does actually keep people well. And of course, another big push for us at the moment, or I guess focus, is building and growing the next generation of primary healthcare nurses. And that's supporting student nurse placements and also asking existing nurses in primary healthcare to come on board and join us so that they can help us grow the next generation, because we know this is how we need to be working going forward. Just the next slide, please, Danny. I won't go into great detail. So there are our three priorities: raising the profile of nurses, ensuring that they're working to their full potential, and growing the next generation so that there's a pipeline of primary healthcare nurses coming through. And how do we do this? We do this through predominantly consultations, building evidence, and representation. I won't read all the fine print there, but essentially the consultation is working with governments and building those government relationships with peak organisations like APRA, the Nurses Board, PHNs. We are also building a Primary Healthcare Alliance, which Ken will talk to you later, but also putting in all those written submissions and making sure that, you know, Karen and Ken are at meetings and at the committees and voicing the needs of the primary healthcare nursing workforce. The evidence is being built in on various fronts. workforce survey is our primary key evidence and data collection point, but we're also building our research arm. We're building our research and evaluation through our nursing and primary healthcare programs that we run. That's the BNC, TPP and other programs you would have heard of, and building our evaluation. And Sam will talk further to representation, which is where you come into it and where our membership comes into it. And that's having our everyday nurses who are doing incredible work actually get involved in advocacy opportunities, which can be anything from reviewing guidelines to talking with politicians and getting involved with the media as well. So I'll leave it there, but they're the three ways we do it: consulting, building evidence, and representing you on various fronts.
Great, thank you so much, Fran. Karen Booth, our president, has definitely raised the profile of APNA through all the work that she does. And I'll hand the microphone over to you, Karen.
Thanks a lot, Danny. Hello, everyone, and welcome to the Nurse Representation webinar. I'd like to say I get to do a lot of the fun stuff, but there is hard work involved, and all of the people on the screen are the backup. And as well as we have an amazing depth of knowledge in our members that we can tap into to help support the advocacy work we do, and having that real on the ground input into being able to feed messages up to the minister and to the high level health bureaucrats that make policy, that develop programs and strategies, I think is one of the real strengths of APNA. Danny has mentioned our workforce survey, and I just can't begin to tell you how important that data is when we are trying to deal with governments, when we're trying to deal with funders for programs, for putting forward the case for raising the profile of primary healthcare nurses. That data, nobody presents it like APNA does, and in the forums we're in. And I think, as I said, I think that's a real strength for us. So the things I've done over the past decade, I've been involved in health reform. That seems like a very long time. I probably almost do long service leave for that. But we've done some wonderful things. We've been started off with things like the diabetes coordinated care pilots, which is about a decade ago. And in those pilots, they said there was evidence that people that saw primary healthcare nurses actually had small but easily measured differences in their health outcomes, certainly in things like their HbA1cs and their diabetic outcomes. And that was only a very small pilot, but it kind of let us know that the evidence is there. And for our advocacy efforts, APNA was part of the MBS review. We were part of the healthcare homes development of the projects and advising on the education component of that, and also nurses featured highly in the feedback from that program. Moving along to primary care, the 10-year plan, and the nurse practitioner, a recommendation for a nurse practitioner workforce plan came from our lobbying efforts during the that 10-year primary healthcare plan development. We went to see the minister, the nursing pecs went to see the minister and said, what are you going to do about this? And before we left the office, said to him, what's your recommendations? How do we get this going? And we came back to him with recommendations, and then the development of the MP strategy was commenced. And we're now at the stage for actually doing the implementation planning for a nurse practitioner strategy. The strengthening Medicare task force, so many things have come from that. That was such an important move. I think looking at not just our lobbying efforts, but also our ability to influence and change. And I think, again, the data that APNA could provide was really, really important. And we had a lot of discussion at that high level. The minister chaired every meeting at that high level to say, actually, nobody understands a nurse's scope of practice. Nobody, or we get very little understanding, or the scope of practice for allied health professionals. There was a very poor understanding of the overlap of skills between medicine, nursing, allied health, the type of things that tasks we can share, the type of tasks that we can hand over, or the type of tasks that only a particular profession could do. So the scope of practice review has come directly, and I have to say directly, from our nursing efforts lobbying for a better understanding of how we properly utilise the workforce. And if anyone has had the pleasure of reading the opening of the consultation for the scope of practice review, it quotes the APNA survey figures of 33 or 34% of nurses saying that their skills are underutilised. So we are directly influencing there. I think just quickly looking at the pictures here, that's me flirting with Mark Butler at the launch of the wound care standards. And he was very flattering at that launch about the efforts of APNA. And our Primary Times, again, articles are being quoted from there. Our annual report, it's wonderful to see how many committees APNA has been asked to do representation on, and to read those reports and to look at the graphics and see the growth of the organisation. And the type of events that we get asked to, things like the launch of the flu season. I've been to the last couple of launches of the Immunisation Coalition's flu season. And maybe the next slide, Demi, please. Which really, the next slide is just me bragging a bit more. And we did visits in Parliament House. The picture of me that flashed up quickly with Jed Carney was at the aged care rally. So I went to with a march with the union when we were protesting about the conditions for nurses in aged care. And that was so well attended by politicians. There were lots of them came down from Parliament House. We had to compete with the anti-vaxxers in the park next door, but it was, such a worthwhile thing to do. And the little purple document that you can see there is our pre-budget submission. And the type of advocacy we do there is we put forward and say, this is the direction, or these are the things that we think that need to be funded for the work of primary healthcare nurses coming up. The 6,000 student nurse placements that was announced in the budget this year was a direct result of our pre-budget submission. So we're actually influencing the direction of the workforce. And I think we are on probably the greater number of committees, the places we need to be. And so Sam said positive disruptor before, and really nurses are seen as change agents, and that's what we're there to do. We take projects, we run with them, we influence population health activities, and the government and the PHNs know that nurses will drive a lot of that important reform activity in their practices. And then it comes to you. So why are you important? We really need your help in representation. We need your knowledge, your expertise. We know that most primary healthcare nurses have 20 years experience at least in healthcare, half of that in primary healthcare. That knowledge is really important to us. And to become whether it's involved, now not necessarily to jump to a national level, but influence locally, and then to influence whether it be your PHN. We have nurses who are reps with local councils. So really important local level, but then also building those skills and being able to step up to be resource people and, maybe do some media interviews to tell your story, because your stories are important. And yeah, I might leave that there and hand over to Ken. Or hand over to Jen to hand over.
Yeah, back to me. Thanks, Karen. That's great and perfectly on time. So, as the monitoring and evaluation manager at APNA, one of my jobs is to keep people to time. And of course, I'm a little bit lenient occasionally because of the great story. So, it's all working well. Ken, our illustrious CEO, perfect to follow Karen to talk about advocacy into 2024 and beyond. Thanks, Ken.
Thanks, Danny, and thanks, Karen. And if Karen gets to do the fun stuff, which is hard work, I guess I've got the really easy slide, I reckon, which is actually telling you a bit about what we're planning to do in 2024, because we don't go into a new year at APNA without having a plan. And it's probably worthwhile as you're scanning that slide, just for me to give you a bit of background, which is, 5 years ago, we had a part-time policy officer, and really it was an uphill battle really to use that resource to do much more. So it really fell to the CEO or the president of the time. And obviously they've got day jobs that sort of involve a whole lot of other things as well. So to even be presenting a slide today, which actually says our policy focus is systems change and our advocacy focus is the potential of primary healthcare nurses, is pretty momentous for us as an organisation. I think it's worthwhile putting 2024 in focus. So it's likely to be an election year. We don't know that for sure, but the buzz around Canberra is definitely that October or maybe November will be when the election is called. And to put that in context, the Albanese government's got until May 2025 to call an election. And the general feeling is that they want to go early. That actually means that the budget, which will be released in May next year, is going to be what they call an election budget. And that means that the group in power at the time is going to use the budget to really make a statement about why they should be elected for the second term. That's great in the context of APNA and healthcare more broadly, because we know healthcare is definitely on the agenda of this particular government. And that means that there's a lot of opportunity to see health spending, which is going to achieve the objectives that have been set out by the government. And we need to remember that this is all against the backdrop of really intractable changes in health. There really are big, hairy issues that aren't easily fixed. And I think that's probably where we're going to stand out, because when we start talking about systems change, we're one of the few organisations out there that is actually providing a positive view of where the system can go. There's a lot of organisations that are doing a great job of only talking about the problems, but not the solutions. And I think that's one of the things that we'll set ourselves apart with next year, like we have the last 3 years, which we will never present a problem without presenting a solution. And that's because we have to be part of building the system that we believe will actually help Australians get healthier through primary healthcare nurses being able to be better utilised. And that's going to come through a number of the things Karen's already mentioned. So we're going to start seeing the output from the scope of practice review, more things coming out of the Strengthening Medicare Task Force recommendations. But we're also going to see the first draft of the 10-year nursing strategy, which we've been waiting a long time for. We're engaged very heavily in all of those. The other thing is we're not going to ask for permission. And for those who have seen us talk at the roadshows and the last Festival of Nursing, the not asking for permission has been a fundamental change to how we work at APNA. And the story I tell about this is plenty of people are telling the government what they should do with their money, and they'll say that it's really important that they do it, but they're not willing to stump up anything themselves. And so if you take things like our student placements program, which we started out of cash flow and have now turned into something that this year will probably place, create 12,000 placement days across the program in its third year. That's us really going, this needs to happen and we're not going to wait. And of course, that's attracted government funding since then because we've been able to show something really tangible. Likewise, there are a number of other things that we'll do next year. And one of the things that I want to tell you about is as we move on to the potential of primary healthcare nurses, is we're actually going to launch for the first time ever in Australia a Primary Healthcare Nurses Day. And sorry for those with eagle eyes, you realise that I've got an acronym that's Primary Healthcare Nurses, then I say Nurses Day, so it's now officially Primary Healthcare Nurses Day. But we're also going to launch a campaign that goes beyond that day. So Danny, if you can just, we're going to give you a bit of a sneak preview. This campaign, this isn't the only image, but there's going to be 3 posters. They're actually going to come out to you this month in your primary time so that you can put them up in your workplaces. And we're going to be distributing these all over the place so that nurses can look at these and think of themselves a bit differently, but also to reposition primary healthcare nursing as to what it does. And Karen's already told you that in the Strengthening Medicare Task Force, we actually realised pretty quickly, most people at the table didn't actually know what nurses really did in primary healthcare. And so this is the anatomy of a primary healthcare nurse campaign. There's 3 images. One is a lot more multicultural, one is a male nurse. And this is all about positioning nurses as more of an aspirational profession. It's all about making them look more like some of those allied health professionals that probably aren't asked to, sort of sit on the front desk or, sort of do a bit of cleaning up at the end of a shift on a Friday evening. This is all about making sure that we present a different view of our profession and really show that it's not about caring. It's actually about that science-based professional. It's about someone who, while they're nodding and looking at you, they're not just listening to your words, they're actually looking at the bigger picture and what's really going on so that they can deal with proper complexity well. So this is our first gambit at really, once again, not asking for permission. We're actually going to run a small version of the campaign next year, and it'll be largely based around posters and social media. We're going to do a launch, we're currently planning a launch at Parliament House. And we're actually going to have the day itself. You'll be asked to wear primary colours for Primary Healthcare Nurses Day. And there'll be the poster campaign that goes for the rest of the year as well, with the idea that we're actually going to tell the government that people need to see this new view of primary healthcare nurses if you're going to retain the profession, but also attract new people into it as well. And we're going to have in our pre-budget submission for 2024 a suggestion that the government runs this campaign and takes it to the next level with big spend behind it. But once again, we will not be waiting for permission. We're going to do what we can with the resources we have to actually really launch this. We're also, I mentioned the parliamentary event, but that will all build up to setting the scene. So setting the scene about the potential of primary healthcare nurses and our advocacy around systems change. That will lead into the May budget, where the government will be making decisions about where they'll allocate their budget funding. And we're looking to see how we can be positioning APNA, but also policy changes from the scope of practice review, from the nursing strategy, and from the Strengthening Medicare Task Force within that. And then that's going to lead into our conference in July. So our conference next year is in Adelaide, and we're going to run a primary healthcare congress there because it's the Health Minister's electorate. And the idea is that we're going to bring leaders in primary healthcare from across every state and territory and nationally in order to really focus the government's mind on what they should be delivering for the nation's health in the federal election next year. And so that's going to be a one-day event actually held at the Festival of Nursing in Adelaide. And that's going to set us up nicely with a front row seat, if you like, and a loud voice in front of the minister to then actually go into the election itself and really have a strong campaign to really drive that systems change and the need for really strong systems change to activate the primary healthcare nursing workforce. None of this can be done without working with others. So I'll go back to our values with Better Together. And that means that we will be working with other organisations to really not just talk about nurses, but also for the need for really strong multidisciplinary care. So we're going to have those alliances that support the campaign. The other thing that's probably worthwhile noting is that our board is picking up a lot of advocacy activity and wanting to take on more. And there's a few on this call tonight. So I thank them for the work that they'll be doing next year as well, and that they've been really sort of getting in behind, because we can't do it without those board members, but also our members themselves taking up the mantle and representation. But what we hope to achieve by the end of 2024 is some tangible policy change for nurses to work to a fuller scope of practice, along with a number of stronger understanding in health policymakers' minds as to just what nurses can do if you actually create the environment for them to use their full scope of practice as well. I'll leave it there and I'll pass over to Mia to go further. But 2024 is going to be exciting. It's great to see how far we've come in 5 years as an organisation that's now at the table, not on the table. And we couldn't be doing it without your support.
It's a good segue, Ken. Actually, we'll hear from Sam Moses first, because the question arises, how can you be involved? And I think this is an important question, and we have many suggestions. Sam.
Thanks, Danny. It's all, you can never find that unmute button when you need it, can you? Okay, thank you. Look, you've heard Karen and Ken mention the Advisory Nurse Panel, which is our representation platform at APNA. And as Karen mentioned on her slide, you know, we sit on more than 100 committees and working groups nationally. So you can see the amount of work, and that's just the work we've been able to say yes to, because there's an overwhelming need out there for nurses who work in primary health care to have a voice by other organisations outside of APNA. So you're definitely on the radar, guys. So if you want to, what can you do? So if you want to be an APNA representative or actually be on the Advisory Nurse Panel, we wanted to call you experts, but you don't like that word, you funny things. So you can do all sorts of things. But to become a member of the ANP, you've got to be an APNA member. That's the first thing. And you have to be a registered or an enrolled nurse. And you have to understand what's expected of you. So what we do is on our website, and you can see, if you go to our website, if you just search apna.com.au, and in the search bar, if you type in Advisory Nurse Panel, it'll take you to a link and you can have a look. And there's a little video that'll play for you about the Advisory Nurse Panel. And then there's a Register Here button. Now, just because you press the Registered Here button doesn't mean that you're in and there's no questions asked. It does mean that it triggers a workflow and you'll receive a whole heap of stuff from us, information that answers questions. And you can always call us up as well and speak to somebody at APNA about it as well. But we'll send you out a charter of expectations and a terms of reference, and we get you to sign the charter of expectations. There's a whole lot of opportunities for you because we all have different strengths and we also have different interests as well. So there's some media opportunities. If you have a particular story that you might want to share, we'd always like to hear about that as well, because we are always looking to share the amazing things that you do with the media. You know, so I was looking at, so we've had our APNA Nurse Awards going recently, and there's been some amazing candidates there who've done some amazing things, and some of those would, you know, they'd make great stories and be great podcast stories as well. You can be a presenter, so you can run workshops throughout the year, or we're always on the lookout for new presenters to join our team of speakers, and we've got space for speakers with your own content, and we've got those that can present the information and the presentations that we actually have at APNA. You can evaluate nurse education, so you can be a reviewer of the existing library of resources and online CPD that we have available to you. So again, if you've, you know, for example, if you are a subject matter expert on asthma, you might be interested in reviewing the asthma online learning, for example. And we also have our APNA endorsement program, and so we need assessors to look at the people who are saying, hey, we want the APNA endorsement, and we get primary healthcare nurses to have a look at that for us as well. It might be you might have a certificate in training and assessment, or some kind of tertiary qualification in education. Goodness knows nurses have got all sorts of things in their bag that they pull out when they need. So there's 100 different ways that you can work with us, and we really need you. It gets back to being better together and being positive disruptors and pursuing excellence. We, as an organisation, wouldn't be here without our members. We value you so highly, and we need you to be at the coalface, representing what is actually going on the ground out there in the nation, and what you're doing for people, and different stories that you can share with them. Because we do find, and that's why we need you to do the workforce survey as well, because when Karen and Ken are speaking to ministers, or even if they're at a round table, there's been different times when, you know, there's been sort of a throwaway comment, and we've been able, because of your dedication and because of your input and because you do the workforce survey, we've been able to say, actually no, and we can refute what they've said as a throwaway comment and back that up with evidence and data. And that's why it's so important that you participate, especially in the workforce survey, and of course why we want you to come on board with the advisory nurse panel as well. So register your interest if you get a chance. Go onto the website or use these. I'll pop these 2 links actually in the chat for you to have a look at. We'd love to hear from you and what your special interests are, and what we do is we keep you in the system, and then when a special interest that meets your special interest comes up, we get in contact with you and ask you. Some of them are paid positions, some of them are shorter, some run for a longer time. There's a whole variety. The review that I was speaking about and the advisory, the assessing stuff is actually paid for as well. And we are pushing really hard to get you paid for any time that you give to this sort of representation. So if you're interested, find out more and register your interest. Thanks very much.
Thanks a lot, Sam. Great lot of things there that are really important. And so look, I'm going to hand over now to Mia Dillon. Mia's, as she said, joined us recently, as we've said. One of us have said that at the very least. But Mia's been working really, really hard and is pushing things along quite amazingly. And she's going to talk about what you've been telling us and where things are going to go from there. So over to Mia.
Great. Thanks so much, Danny. So as Danny said, I want to take a couple of minutes just to talk about the workforce survey that Sam highlighted so passionately about, an important way for you guys to get involved. So we've been running this workforce survey for over a decade, and it's the only national level survey focused on primary healthcare nurses in Australia. So it tells us about the work that primary healthcare nurses do, which is actually, without the survey, largely invisible to policymakers. So it's really important to get the data. And that information and the insights from the survey are actually the intel chip that feeds our advocacy efforts. And as Sam said, helps us back up our advocacy positions, whether it's in submissions or refuting some of the commentary that might come out in the public. So I wanted to talk to you at a high level about what the most recent 2022 survey has told us. So as a group of primary healthcare nurses, it's told us that you guys are highly educated and experienced. So we've got some key stats there, but basically a mean age of 51 years, more than 28 years average experience in healthcare. And the thing that I really love is that a third of you, so 30% that responded, are still furthering your education. So, at a mean age of 51 and still pursuing education, to me, that underscores the dedication of the profession and the highly educated sort of group of nurses that you are. Also tells us that you're highly respected. So Danny's just brought up a chart that provides a visual of that. So we know you're highly respected by patients and colleagues. You're also highly respected by managers, but the gap here is that for primary healthcare nurses, which are quite a diverse bunch, in some instances, your managers may not know what you do. So if you're reporting to non-health managers, and this comes up in school nurses, they may actually not understand what your day-to-day work actually entails. That's really important for us to know because, again, it provides insights that we can use to feed our advocacy efforts. And we're also doing a lot of work, as Ken and Karen said, to speak to government to make sure that primary healthcare nurses are seen, that their work is visible, and that they're valued. So, we're hoping that incrementally your perception of value by that sector is changing over time, at least in part due to the high advocacy efforts that we're doing. So the next graph here tells us how utilized you are. So nearly about 2/3 of primary healthcare nurses are saying that they are regularly used to their full extent of training and qualifications. That's great. But we also know that that means a third of you don't feel this way. So we know that also there's more data underneath that we're not visualizing, but we actually asked that third of the nurses, hey, have you had a conversation with your manager about being able to, work more to your skills and experience? And nearly more than a half actually said, yeah, we have had that conversation. And based on that, our manager has extended our scope of practice in some way or allowed us to work more heavily to their scope of practice. So actually the majority of requests, so 44% said they were either negotiated successfully and 33% under consideration. So that's over 70% saying that has made a difference. We know that there's still a small percentage there, that there's more work to be done. And because of the survey, we actually understand what those barriers are. And again, that's the intel chip that's feeding into the advocacy efforts that we're doing. So what we do with this information, I think it's got some really important insights that we've talked about, and I was going to talk a little bit more about it, but Karen and Sam have actually articulated quite well how we use that. So we use the insights from the survey as a credible evidence base to support our written policy submissions in meetings with ministers, the Department of Staff, and through our representation activity. And we know that gets seen, as Karen said, the scope of practice review has referenced our workforce survey. Australian Institute of Health and Welfare certainly uses that data to profile primary healthcare nursing. We know that workforce agencies are using that information to get a better understanding of the workforce in their regions. So we know all of this data is actually being seen as well. So really, I'm going to keep it short and sweet, but my call to action and request is that you do complete the workforce survey. We've got a QR code. It takes about half an hour to go through, but that half an hour is the best investment, in my view, around furthering primary healthcare nursing as a collective group. So yeah, please take a moment to complete it. And also there's a link to the advisory nurse panel that Sam talked about in the chat. So do take a look at that as well.
Thanks so much, Mia. Well, we've heard from our illustrious panel, Frances Lack, the APNA Advocacy Manager, Sam Moses, our APNA Founder and Nurse Ambassador, Karen Booth, President of the board, the APNA board, Ken Griffin, our CEO, and Mia Dillon, our General Manager of Healthcare Solutions. My name's Danny Hills. I'm the Monitoring and Evaluation Manager. And I think that we've really covered a lot of ground there on what advocacy can do for you. And of course, we have that open invitation to come and join us in a number of ways. Of course, one important voice has been underlined a number of times here is our workforce survey. The workforce survey really does make a difference, and that through the efforts of our members here, we get to translate that evidence into recommendations, and where necessary, we might take up the cudgel ourselves and take that call to action to heart, like we have with our student placement programs. So look, it is open to you now. I'd be very happy if anybody has some questions. You can type them in, or you can, I think if you raise your hand, I should be able to see your, be able to hear you ask a question. Right, so one of the first ones was around how can we get nurses involved in APNA's events such as Primary Healthcare Nurses Day, and we do circulate a lot of info. There's a little bit of an answer there in the chat. I wondered if perhaps Ken or Karen could just have a little bit more word about how we can get people involved in the programs that we offer, education, the Nurses Day that's coming up, and also the Festival of Nursing.
So particularly on the Primary Healthcare Nurses Day and also the campaign around that, which I gave you the sneak preview of. As I mentioned, the Primary Times that's coming to you this December will actually have 3 posters for that campaign, and you'll have the ability to print out more if you need them. And the idea is that that can be going up in, waiting rooms if you're in a general practice, but if you're teaching at a university or a TAFE, it can be going up there, so students can be seeing those. Or staff rooms if you're lucky enough to have one, depending on your clinical setting, with the idea that it's actually starting to chip away at that perception of nurses. We'll also have a number of resources online that we'll be sending you, and you'll have plenty of reminders in your Connect email that comes out every Monday as well. Part of this is that we will be putting a bit of media support behind it. So if we do well and don't get trumped by anything else, you will see it in the news in and around those days too. And then the idea, of course, is that the day itself is the call to action. So I'll have, wear primary colours, so Primary Healthcare Nurses Day. And because it's a trial, we will evaluate it to see if that's resonating with both yourselves and with employers, and whether we're getting the media coverage that we need to help shape the debate around healthcare and how nurses are used within that. And then, of course, the posters will last long after the day has gone itself, but it will serve as a good launching point. And those will be, able to be kept up for a year or 2 as well. The idea is if the campaign is successful, we will run it annually and we'll refresh it every year. But once again, as Sam said, we're being data driven with everything we do. So we'll evaluate everything that we do that's new. We're not seeking permission to run these things. We're jumping in feet first with the best information that the data and your feedback tells us, and we'll keep reviewing as we go so that we can keep repeating successes and killing off the things that aren't as successful along the way as well.
Karen, there's a great question here that I might throw to you, and that is, how will introducing multidisciplinary models of care help nurses?
I think it will help to break down barriers, but I think it also help to the professional satisfaction and they're able to use their skills. And nurses are used to working in teams and contributing. And I think that, one of the positive and I think really heartwarming things about the current wave of health reform is that they're actually really talking about patient-centred care, whereas often people say, oh, patient-centred care, it's a jargon issue. But I think now's the time where people are actually looking at it as a real potential to consumer in their own healthcare, and the consumers are actually driving some of that. They want team care, and they're certainly lobbying for team care. And I think it helps us to show the great work we do. And actually, nurses, we're not very good at measuring outcomes. So I think moving to some of the film clips on our website, Building Nurse Capacity Clinics, the nurses driving a lot of activity, but that's part of the team. And, we are starting to see positive outcomes coming clinics. And there's a good that at a national level, certainly government talking about multidisciplinary care, but also the PHNs are funding, wanting to know more about how do we get these nurse-led clinics going? How do we get, a contribution to team care, particularly in general practices and ARCHO settings. So potential, and not just for patient outcomes, but professional recognition and job satisfaction. There I bore you with some more jargon, is all part of the quintuple aim of primary healthcare and professional satisfaction. So, yeah.
Thanks, Karen. I wonder if I've just asked Sam to unmute herself, because I thought that, Sam, you might be able to follow on that question. I mean, we have been around a while. And of course, as the founder of APNA, you've seen a lot of change. And like my background's in community mental health, that's really where I did a lot of my clinical work. And working in multidisciplinary teams was quite normal for me, but and I particularly loved working with the community nurses and also working with general practice, because we just got a whole rounder model. But I think it exemplified the work that nurses did. So,
Yeah, no, happy to comment, Danny. And I think, again, it gets back to our values. I guess when I cast my mind back, 20 odd years ago, nurses, and we all, we began in general practice, but that's clearly not where we are today. We're very, very primary health care across the board focused. And so if you look at where these nurses are working now, I think, it's now, back 20 years ago, it wasn't commonplace prior to that to have even a nurse working in general practice. The receptionist might do a bit scarily, and or the doctor's wife, or this sort of thing was pretty common. And now, it pretty much, and there's a statistic that I'm not, I don't have in the top of my head, but most general practices now have nurses, at least one nurse who works for them, if not a team. And one of the things that we're hearing, I had the privilege to go to a roundtable recently about the first 2,000 days of life, and there were doctors and midwives and a whole raft, allied health professionals, all sitting at the table, and it was a whole day thing, and we worked really, really hard, and everywhere around the table echoed the same thing. They talked about how team-based care was the only way to go, that the health system is kind of broken and we need to fix it, and the way forward is to combine all the strengths that we have as health professionals and focus on the patient at the centre, and to be able to give them the best care and really impact change, and obviously keep them out of hospital. That's what primary healthcare nursing is all about, whether you're working in a school or whether you're working in aged care, community, mental health, midwifery, wherever it is that you're working. We're always trying to get ahead of the curve, I think, and keep people out of hospital. And that's especially true in aged care, obviously, and trying to stop them from having these trips to hospital that are so unnecessary. So again, I'd like to encourage everybody to be positive disruptors and keep chasing excellence, because if you've got a good idea, and there's so many good ideas out there, let us know about it. Call the nurse support line or email me, or you can find the number and everybody's emails on the APNA website. We'd love to hear from you because there are so many good ideas. And in this climate that we've got at the moment, where primary healthcare is definitely in the forefront and on the radar, now is the best opportunity to be able to make the most of that. I've seen a lot of change, I guess, over the years, and we are doing it better, but we've still got a long way to go, but they're listening, I think. And that was, I guess, another question, do we think that the government's really serious about primary health care nurse reform and improving things for nurses? I like to say yes, I think they are very serious about it. Karen and Ken, perhaps you have a better idea of that than I do.
Well, maybe I'll jump in first, given Karen's just come off mute, but I'll leave the last word to Karen. But I would say what we know from our time as an organisation that's just about to go into its 23rd year is that we've got excited before about governments that have promised a lot and small movements in many ways. We also know that we've made introduction of PNIP, we actually didn't realise it'd have the consequence it would on practice nurses, for example. What we know is that there's been a lot of promises made over our 22 years, and for a lot of organisations that are older than us, they've probably heard a lot more. I would say we'll always judge a government by its actions, and what is clear is that this government has been creating this pathway for our profession. And whether it is able to get elected at the next election to continue that journey remains to be seen. That's up to the Australian public. But what I would say is that, they actually put funding behind the recommendations of the Strengthening Medicare Task Force, whereas previously the 10-year primary healthcare strategy was unbudgeted completely. So we wasted a lot of time, if I'm honest, actually being there with a lot of very important people at the table for something that had no way of getting into being without funding put behind it. So I think it's credit to this government in the short space of time that it's taken the steps it has. And I think that, look, nurses are very practical people. We know a lot of hot air. We see a lot of hot air. So I think we've got the right to be optimistic about where this government is taking things, especially given they're listening to nurses. And I think we've got every right on top of that to hold them to account to make sure they continue down that path, given we don't see an alternative to actually being able to give the benefit to the country's health that nurses can.
Thanks, Ken. Yes, last word to Karen.
Look, I would just echo what Ken said, and we are being listened to. I think at this time in a long time where I felt as though in a very positive way. We have the government quoting information from APNA. We have the college GPs quoting information from APNA. And my dealings, the three main medical groups in primary, the College of GPs, rural and remote doctors, ACRAM, and the AMA, everyone is saying we need to change what we're doing. We need a much better focus on team care. And will say that they can't work without a nurse. All of those things will drive change. I always say market forces will help as well. There's practices poaching each other's nurses. You know, that's a conversation for a glass of wine in another day. But I think there's also an awareness of the pay that a lot of times in the Medicare course. So there's an awareness of that. So, you know, I think we'll, you know, for our first 12 months of government, they've done a lot. I think there's much more to come. So I'm at this point positive. Thanks
a lot, Karen. And look, I'd like to thank everybody again. Frances Lack, APNA Advocacy Manager, Karen Boothwood, President of the Board of Directors, Ken Griffin, APNA CEO, Sam Moses, APNA Founder Nurse Ambassador, and Mia Dillon, APNA General Manager of Healthcare Solutions. Thank you for those who've been here with us this evening, and that will be our close for tonight. Thanks again.
Thank you, everyone, for your time. Thank you, Danny.
Thank you, everyone. Thanks, Danny.
Thanks, everyone. Good night.